All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So first of all, let's start with a disclaimer. So here is the disclaimer. There is a disclaimer in the description as well. Please make sure you pause this video and watch it and read it, or you read it in the description. So with this, long time no see, huh? So wanted to give you a quick update as well for what is going on. So number one, tomorrow, please remember, Dr. Demello would join us from India tomorrow at our 9:30 Pacific time, 9:30 a.m. in the morning. So tomorrow we would not talk in the evening. We'll just have a session at 9:30 a.m. Pacific time tomorrow. So that is one. Day after, if you are okay, I want to take an off because this is a long weekend. Monday is off, so I'm going to take a Monday off. And if you're okay, I can take a Friday off as well. So I'll have 4 days off. So that is two. And again, please tell me in comments if you're okay with this or not. And finally, I also want to say hello to everyone. description, yes, speed reading or less speed reading. But the basic idea is that please realize that there is no medical advice here. I cannot give you medical advice. I should not give you medical advice. I do not practice in the US. So even for outside of the US, I cannot give you medical advice from this from online systems. So please be kind to me that your questions, mechanism of actions, or mechanisms of, let's say, vaccinations, those things are fair things. We can talk about them. We can explore together. But personal advice is not possible. Even for those countries where I can practice, personal advice like this is not good. So I hope that you take this as a learning resource, an educational resource, and that is valuable. I'm not, I shouldn't give more than that. So this is one. Secondly, wanted to update you. So what is going on? I'm gonna, so there is a bunch of folks. I suspect who they are. I do not know though. Who have been nowadays just sending emails and messages and complaints about this work to far and wide. I am getting messages almost from every corner of the world that most of them are saying Mubin is a fake doctor. So that is, of course, not true. My medical degree is here. And so that's not true. Anyways, and as part of that, there are folks who are complaining about me here in this state as well. And that is not a small thing, because it's not to report to YouTube to say, take this video down. When they report me to California or they complained about it, then the state itself starts talking with me, and that is what is happening. And sure, somebody is so upset that my uncle, when I was growing up, he was a businessman and he used to give me advice. I narrate his advice or mention it many times. One of the advice he gave me was, he said, sometimes there are folks in our life who become so unhappy that their total mission becomes to just keep complaining about you. And that causes a lots of noise in your life. So just be aware of that. So there is this, these are the things that are happening. I think this is this is something I have to go through, because I had the audacity to continue for these 1.5 year to create this caravan and to talk with us and to explore things together and to bring in this education from various studies and kind of illustrate that and share that. And some folks are not happy. Not that they're not happy because I illustrated and shared. My suspicion is that they're not happy with what I'm saying. Maybe they wanted me to say differently. And I do not. I have been offering what I think from an educational point of view is important to see. Here and there I've given my opinions, but these are my opinions. And so right now it is me, my lawyers, and the various departments and talking, and so it is wastage of time, wastage of lots of money, focus, stress. So I may have to start taking medicines with Luffy. So Luffy is taking medicines, and I'll have to take anti-stress as well. But this is what is going on. So because of this, I become a little distracted sometimes, and sometimes I'm not able to continue for multiple sessions. I didn't want to. Some cool beans asked me to do the GoFundMe or those. I feel so. One of my behaviors is that when I am under stress, I become very isolated. This is just from very early on in my life, that I become isolated and I connect less instead of connecting more. And so the result of that is that I go out less, I reach out less, and I ask less. I actually become more closed. That's just how I have been. So this is the kind of things that is happening. So it is beyond just the YouTube reporting and those. It is lawyers, and it is departments, and it is people's complaints, and then explanations and documentations. And so there's a lot of such things happening. We'll see how it ends up, but that is where it is. All right, so Augie says, don't give in or they win. Augie, the question is, how far do they want to stretch it? Because my uncle used to tell me, and again, not here, in a different country, I come from Pakistan. He used to say that some folks can use government departments as weapons. They can complain to them, they can activate them, and they can create noise. So this is the kind of noise. I hope that things will be fine. The good news is my daily activity for last 18 months have been in front of you every day. My preparations, my discussions, my chats have been with you and in front of you. And you can tell me how much of incorrect messaging you observed. The intent has been always to make sure that we can be as safe and protected. A pandemic is a new thing. None of us, I think mostly, went through a pandemic before. And I also believe that the modern medicine is new now, but for thousands and hundreds of thousands of years, we have been finding plants and practices and methods and things and sharing with each other, exploring together, trying to find things that may be helpful. I thought that with the pandemic, there was a positive side of it, and that is the whole world became focused to try to figure out, how do we save ourselves? How do we save the people around us? Would this medicine work? Will that medicine work? Will this process work? Will massaging the neck work? So there are these things that happened. And I think it is a fair thing to explore and learn and figure out what can be possible. It is just this, that once we, for example, yesterday we talked about S1 part of the spike protein causing acute lung injury. That should generate some thought in mind to say, okay, what kind of a vaccine can be there? What kind of a drug can be there? We talked about proteases to say, well, TMPRSS2, which is a protease, can cause the cleavage of spike protein from S1 and S2. And so then we can think about, well, are there drugs like bromhexine or other? How can they help? Can they block this function? And if they block this function, will they block some critical functions of our body which are needed? So what would be the side effect? What would be the positive things? So I think this is how medicine evolves and grows. It is not one company's job or one person's job. And so trying to punish everyone who will say things other than what you think is right is actually not a correct thing, my opinion. But of course, when somebody is in that mindset, then they are in that mindset. So having said that, we will continue to move forward. I would request you to make sure that you have read the disclaimer. Please know that this is not a medical advice session. This is a education session, informational session. Your doctor, and I always try to say this, that, hey, please talk with your doctor. And also know that I don't practice in the US, and I have always said it, that I don't practice here. So please keep those clarities in your mind. We should talk more education, medicine. I think that is a good thing. And I don't know if you have any suggestion. Please tell me that, how do I manage? So this is an extra set of noise. I was talking with my wife this morning, and I was saying, running the business, and of course, businesses issues, then preparing a talk every day, looking for various studies, seeing what is it that various people are saying, creating a talk, then creating the illustrations, then interacting with the family, and that time interacting with the cool beans and that. And now an additional noise for me, or additional set of tasks for me, is to handle these extra things. So it is becoming more and more of a stress and burden on me than it was earlier. So just be aware of this. Okay. If you have any suggestions, please tell me. Let's see some questions. So Melly and Leon says, how does yesterday's discussion on what creates a cytokine storm impact vaccines? So from a mechanism point of view, the way I thought about it, and again, I may be wrong. So the shorter answer, that really do not have a good answer, but what I thought was, some of the vaccines have the S1 subunit kind of, or the spike protein locked in a way that it cannot be disassembled, or it cannot open up. Now, what I do not know, and this is why answering this question is difficult for me, what I do not know is that if this spike protein, if at all it gets out of the cell, gets attached to an S1, will TMPRSS2 be able to cut it? Will that cause the S1 to be released? Would that cause any issue? This part is not known to me at all, because this data that can spike protein get out and become fully cleaved like a regular spike protein? Is that possible, or this locking mechanism helps or not? So this data, I think, will have to come at some point. That is one. Second way of thinking is this, that the quantity that a virus produces versus a vaccine produces are different. So again, these are the way I have been thinking. General answer, even Dr. Paul Marik's comment was, don't really know what are the implications for vaccine, because the testing done was only on separated S1 pieces, separated spike protein, and saline on human ACE2 enzymes and non-human ACE2 enzymes. So because they were already kind of prepared that way, that is the data. It cannot actually be fully applied to COVID itself or to vaccine. And that is why they, if you look at their conclusion, that was something to this effect that, hey, we have demonstrated that this can cause the acute lung injury. Now there may be more studies needed. So there is a direction in that message. I don't think there is a conclusion. Okay. So Marie says, is it true that vaccinated people can shed contagious COVID-19? So we have done this discussion somewhere in the past as well. And I will once again have this say it this way, that first we know that for example, Pfizer had published a lot of data from Israel. One of the study was about the efficacy of Pfizer in Israel. And they had said in that we didn't have a way to measure the shedding or spread of the virus by vaccinated. And generally, this is true for vaccinated or unvaccinated. You can't really follow a person enough to see who else did they make sick, unless you're doing very rich contact tracing. So that is from a practical point of view, that how much shedding, will the shedding occur, what kind of virus may be shed from a vaccinated person versus, let's say, not vaccinated person. This whole data is not available. From a mechanism point of view, where once again, I'll keep saying it, I always say this, I may be wrong. From a mechanism point of view, we, at least from immunology's mechanism, we know that if after the vaccination, let's say if the infection occurs here or the exposure reoccurs here, then this is a study from China that showed that it takes a few days. And this is part of immunology as well, that we know that immune system does not start responding right away unless that immune system was already revved up. So let's say if I got infected today, and about a week later, my immune system is all revved up. Now, if you expose me to more viruses, then what? I'm already battling with one. But when the immune system has gone down and is calm, and then an infection or an exposure occurs, now the question is how fast this immune system will start making copies of the B cells and the T cells, that the ones that are in memory, and how fast would it start making the antibodies? So let's say IgGs. This time between the infection and the immune system's revving up, and then this time virus's behavior, how fast can virus get into our tissues, our cells, and how much of a virus load can be created. So let's say over here there is zero load. There was zero load here. So let's call this line 0 instead of this baseline. This is 0. Then as infection occurs, how does the virus load go up? and then with the antibodies go down. And is this viral load sufficient to cause shedding? Is the person shedding here as well? Is that virus that is being shed viable virus? That is not known. But this is possible that in this time, a person might shed. Now, this window of time in somebody who is being exposed for the first time will be longer. They would keep doing it for a longer period of time because their immune system is still getting up to speed. In a vaccinated person or previously infected person, this window may be shorter, a couple of days. Okay, so Roman says arm pain at injection site and some numbness. Roman, is that the second dose, first dose? So Pasi, yes, I know that Campbell talked about it. And if folks know here, I talked about that UK study as well a few days ago, where they said in that study that because of the R naught of the virus and the shedding from a vaccinated person for this time, it is, they said herd immunity is not going to be achievable. And universal vaccination is the answer. I think that was the kind of statement in that study. Stratelize says, do you need to start a defense fund? So I have started paying the lawyer and their retainers. As I said in the beginning, I become a little shut down or isolated when I'm under stress. And so at that time, for me to come out and request for anything becomes difficult for me. So maybe I hope these things just calm down soon, but we'll see. Amy says, can loofymetin prevent S1 from damaging our cells or cause cytokine storm? So the in vitro study that was done, in silico study that was done about the ivermectin and the spike protein, it showed that ivermectin binds to the spike protein. What I do not know is exact place. So if you see here, you can actually Google it, or I have that link of that study, exact place of attachment, and if that affects at all on S1 side or S2 side or not. So that part is unknown. Patricia says, what is the status of having the doctor from Brazil with P1 variant? I'm going to request them to join us soon. I'm so happy that you are such a great doctor in person. Say hello to Luffy and his sister. So Kyrie is right over there. Cannot remember her name. Her name is Kyrie. She's right over there. Luffy is outside. Jeremy, thoughts on tetanus booster? I just received mine today because of the last vaccine I took was 10 years ago. I'm wary now of other vaccines because the COVID one. So again, I cannot offer a directed advice. However, from the advice about the vaccines and the practice of getting at least COVID vaccine, they have been saying that try to get the vaccine away from other vaccines. And what I've heard from various people has been 2 to 3 weeks or more, so that if there are any side effects, these can be separated from, was it from the other vaccine or was it from this? Similarly, if there is some acute flare-up of some disease, then if that is not something for which the vaccine is right away needed, the COVID vaccine, which I would suspect in most cases no, but if somebody has some, let's say flu or something, again, not an advice to anyone, just thinking aloud in a more educational terms, that their body is under stress at that time, their immune system is under stress. So adding COVID vaccine at that time may not be, if the side effects appear, how do we say, is it flu or is it COVID? So I think these are the kind of considerations for healthcare professionals when they are thinking about vaccinating their patients. So I hope everyone who is happy that they are in a good shape, I hope that is because of the educational aspects of the discussions. And Heather says, Dr. Demello suggested that infected person treated with Ivermectin was no longer infectious after 2 days treatment. I do not know what is his reasoning. So tomorrow we're going to have him, and so we can ask him about that question. Because the virus infectiousness, shedding, all that depends upon the virus's load itself. The Cali study, the Australian study that came out, the first for ivermectin, in that study they had said in vitro, not in vivo, not inside our body. In vitro, they had said that they put some cells that were infected with SARS-CoV-2 and then they put ivermectin on it. The dosage was large, and then that within 48 hours brought the viral load very low. But now that kind of dosage is not given in human therapeutic doses. So if that is the case, I don't think that there is a 2 days impact on human body. So thinking about mechanism, I would feel no, but we can ask Dr. Demello. So what happened to, okay, so Andrew, can you hear me? And so I'm using OBS today, so I do not know if there is a voice lag, and secondly, if you can hear me well. So have you seen the great result of fluvoxamine on Together large trial? I'll have to look into it. Moreover, can you please comment preliminary result of fenofibrate? Thanks. Andrew, I would look into it. Thank you very much for everybody's super stickers. Yes. So Cheyenne says, have you heard of the mu variant? Yes. And actually, that variant, so far today, what I heard, it hasn't risen to the point of being a variant of concern. But what I wanted to do was to talk about that variant and its mutations and what is the effect of it. Amy says, I can hear you well. Thank you very much. Night. So Gweli says, now that we have seen 2 years of late summer COVID outbreaks in the South due to the heat and people flocking indoors, why did we never see this with the flu? So both viruses are different. Both viruses' dynamics are different. Their mutations are different. Their behaviors are different. Although I do not know if what you're saying here is a dynamic of COVID. COVID or SARS-CoV-2 had a dynamic that the whole body and everybody was open to it. So I think seasons had some impact, but not that big. We will see as we continue to move forward and more people are protected. Then we'll see how the virus itself behaves with us. Stratilize says, should Novavax using whole spike protein, not split in the... So my knowledge is that the spike protein in Novavax is the whole spike protein. It is not S1 subunits. So, Wendy, this is a very, very interesting. How long do you see Delta being this bad? Do you think we are close to the downhill side? So, this is a very interesting question. I was reading an article this morning about the 2 month cycles of the variants, where they had said, as an observation, we are seeing that most of these variants have 2 month cycles. And so, with this, so this was in a big newspaper. So then the author or writer was saying that doesn't mean that we should now start celebrating that if it is the second month or the end of second month, then the delta is going to start going down. But these are the kind of cycles observed. The question really is, why does the surge start going up? I have been thinking in the past that it is possibly human behavior, which includes protecting, staying indoors, physical distancing, as Dr. Z said that day, instead of saying social distancing, mask wearing, washing your hands more, in addition to all other protective measures, and then vaccines. So I think these things together affect the overall dynamic of the virus, and then virus side as well. The virus is becoming, for example, let's say, more contagious. It is becoming more and more rapid in causing replications. Not replications, getting into the cell and replicating and coming out and then getting in again faster. So the viral load increases faster. I think all those dynamics work. I had this question in my mind this morning. I wanted to look at some of the data myself as well. So you know that I first look at studies and data before I start talking about it. So give me a day or so. Maybe now tomorrow we'll talk with Dr. Demello. Friday, Saturday, Sunday, Monday, I'm going to be off. So hopefully Tuesday onwards, we'll have this discussion as well. But do me a favor, look up, for example, let's see right now. Here, let's see worldometer. Let's go to world. Daily new cases. So if you see here, let's say the first time appearing here, March 12 is when they started putting data at March 10 or so. And then it increases. Let's look at this one. It started where somewhere here, this is March 5, Feb end, let's say. Then whole March, whole April, then May, and then June. So this is not 2 months. This is anywhere from March all the way ending in June. If I go here, this is October going all the way to February. October, November, December, January, February. So 5 months. So these peaks seem like 6 months. And this is at the world level. I realize that. So if you see here, this is June 23. July, August seems like receding now, and maybe September, October. So again, 4-5 months here. This was 6 months. This was October to Feb. October, November, December, January, Feb, 5 months. Now, if we go to a specific country, let's take USA. Okay. Ideally, we should have a superimposed variant map to see which variant at what time. But let's look at this peak. There was some variant here. So October, this must be the alpha variant. October all the way to Feb. So that's not 2 months. That is October, November, December, Jan, Feb, 5 months. Then here is a smaller wave, anywhere from March, let's say, March to April. So that's really, it looks like remnant. Then here, starting, let's say, July, and then August, seems like it would recede faster. But I don't think that this is going to be, see here, if this is any indication, it is November, December, January, and then February. So if this is the peak side, August, September, October, then November. So it's probably going to reduce. Look, there are obstruction to the virus now. The vaccinations, as they continue to increase, the virus would have less and less ways to continue to spread faster. So how does it close? I think it might be rapid compared to here, but I don't think that 2 months data was exactly correct. Let's see some other country. Let's see. How about we look at, let's see India. Okay, so India's daily new cases, there is this wave, tiny wave. So let's say started somewhere in July of last year, continued November, July, August, September, October, November. So not 2 months. Here, March, and continued till June. March, April, May, June, 4 months. So doesn't make sense to me. So to answer your question, I don't think that it is going to be on the recessive side very fast until once again people start doing the protections. Not Alice. I had an antibody. See, those questions that I have, they are as much as I would love to answer these. So hypothetically, it is possible for some test kits. So this is not directed at you. This is not an answer for you. But generally, a test could cross-react with some other antibodies in our body and kind of still register some presence of antibody or antigen without actually having it. So this is why most of the tests have a threshold. Below that is unsure area. Jean, thank you very much. Augie says, NIH study suggests CBD inhibits COVID RNA transcription. Isn't this a big deal? It will be a big deal if, meaning it is reproducible and the study size is good. I would love to see that study. So I'll do a Google and see what that study shows in terms of data. Michelle says, why is the chat below the video? I don't know. I think it is really YouTube, how they decide based on how wide is the screen to say to show it on the side or below. But there is no setting on my end. Soma and Srijoy says, sir, is ADE a little more concerning for inactivated virus vaccine than others because of experience from RSV, and it is the reason why most countries avoided inactivated virus vaccine? So Soma, first, I do not know if that was the reason that countries avoided inactivated virus vaccine. Secondly, ADE, we have discussed this many times. So far, ADE is not proven. And even the study, I mean, people go after me, as you're seeing, but there are actually folks out there who picked up a study which said with our in silico findings, we think there may be a potential for ADE. And that kind of a statement can be constructed with so many ways. And this is what I think makes people upset, and that they go and report me. Hypothetical ADE is still hypothetical. We haven't seen it yet with the SARS-CoV-2. Zan Solo says, should one who already recovered from naturally from COVID get the vaccine? So, so thing is this: there are folks, I believe, who, anyways, look, I have always said that a natural infection does produce enough antibodies, and then in a healthy person, and then memory B cells, memory T cell, that when the re-exposure occurs, they are able to defend it. And I have explained it many times that a possibility in change in virus, which could then cause the previous immunity to be of not much use, or a possibility of change in a person's body's status. For example, their immune system is not as active anymore, or their immune system is not as good anymore. Maybe let's say they became diabetic and now they're out in their diabetes is not in control. That means their cells are not functioning correctly. So they were exposed, but now they cannot handle it anymore. There can be tons of reasons. Malnutrition can be the reason. Bone marrow issues can be reasons, and there are leukemias can be reasons, cancers, grafts, immunosuppressive drugs. There are many reasons. So it really depends upon that person, when were they infected, what is the state of their body, what is the state of the virus, which would then tell if they need the vaccine or not. So this is why I think most of the vaccine programs simply say, just go get the vaccine. So it was interesting for me to look at Ireland, that they at least did some thinking there to say, okay, 6 months or 9 months. So you saw that in one place they said 9 months, in the other place they said 6 months. Recovered 6 months before till now, they said is similar restriction as fully vaccinated persons restrictions. Patricia, tell me who's stressing you out. I'll find them and run over them with my power chair, then hitting over the head with my cane. Thank you very much for your love. I have no idea. But there are folks, and it's not just here, they are reaching out wherever they can. Give me 1 second. Let me see if I can open the door for Luffy. Hey, Luffy. What are you doing? Check who's here. Okay. Luffy just came back from outside. He has become such a, what are those folks said who just spend more time outside? He has become sort of a happy teenager who likes to be outside. Okay. BignattyBrubz Hugh says, can you please address the claims in chat that the vaccine is creating the variants? It's getting old seeing his claim being repeated in chat over and over. So vaccine is not creating the variants. We have done this discussion so many times. Variants, I have shown, if there are folks who remember, I have shown this nextstrain.org, this one, SARS-CoV-2. I have shown this. Then there is outbreak.com, I believe. All of these dots here. So look at this. I have read this disclaimer from them or information from them many times that they say there are millions of complete, it's kind of gray, there are millions of complete SARS-CoV-2 genomes available, and this number increases every day. This visualization can only handle 4,000 genomes in a single view for performance and legibility. They used to say 3,000 over here, now 4,000. Because of this, we subsample available genome data for these analysis views. Our primary global analysis subsample to about 600 genomes per continental region, with about 400 from the previous 4 months and about 200 from before this. This result is a more equitable global sequence. The point I'm making is, look, the words millions of complete SARS-CoV-2 genomes, millions. So saying that this was vaccine is incorrect. And I am under pressure or not, I have been saying this from ever, that it is not the vaccine, it is us. Whenever the virus enters our bodies, it makes its babies, which are slightly different. Some of them, I think this is a year ago, a discussion I did. Some of them, the daughter viruses, are not fully mature and correct in structure, and they would not even survive within that person. Some of them are going to be very closely like their parent, and they would survive and they would continue to infect and even get out. And then some of them will become a little more powerful in various ways. And then if they get out, they are a variant who have a chance to continue to spread more. And variants are produced by everyone who was infected. It has nothing to do with vaccine or not. And then some variants are more powerful than others. Somebody said, Rima says, much of what you've been saying for a year are now proving true. Correct. From a mechanism point of view, Rima, these are the things that were correct. And I think that's why I was right. These were in the books as well, not for the SARS-CoV-2, but for the other viruses and the mechanisms of immunology. Gabriella says, please let's organize a GoFundMe for Dr. Bean's legal expenses. Thank you. A.R. Pramod Kumar says, sir, do you watch anime? Luffy is the name of a protagonist of anime named One Piece. That is correct. Luffy was named after One Piece's protagonist. So it is not me, actually. I have watched less anime. It's my wife and children. They watch a lot of anime. They love it. And both name, Kairi and Luffy, came from these animes. Luffy is funny. And as you said, in One Piece. Guy Telfer, can a lipid cell be considered an adjuvant, like the ones they use with the COVID-19 vaccine, or how would the immune system react if delivered without CV19 in the lipid cells? This is a very interesting question. So let me see if I got your question correctly. Moderna said with their vaccine that we do not have any other adjuvants because we believe the lipid nanoparticle itself can trigger some of the immune system's behavior as well. So if you are talking about that, for example, then yes, at least Moderna has proven it with their vaccine trials. What is the job of the vaccine? Bring in messenger RNA. I'm talking about the Moderna and Pfizer, for example, or bring in virus particle, for example, Novavax, a subprotein of the virus, and then kick the immune system enough because the dose is small for the vaccine, correct? So with that small dose, you still want immune system to react a little more so that immune system can start learning and creating memory cells and B cells and T cells. So you kind of kick it. And to kick this, there could be adjuvants in the vaccine that kind of act as an irritant. For irritant, I'm using a loose term here. They activate the immune system. And Moderna's comment was, and I think I talked about it first time with the Moderna vaccine a year or more ago, 1.5 years ago, I'm still stuck at a year, 1.5 years ago, that they had said that their vaccine doesn't need adjuvants because their lipid nanoparticle can act as a immune activator as well. Something to that effect. So Tika says, what about when people tell me because of the unvaccinated, we have the variants? How can I respond to that? Okay, so the answer that I'm going to give is more of a mechanism-based answer. It is not a pro-vaccine or anti-vaccine answer. And from a mechanism's point of view, number one, a person who gets the virus can shed with the variants, correct? So that's what we just saw with the next strain. Millions of variants are created, mutations are created. Now let's say we have two people, and I'm assuming them to be healthy people. I'm not assuming their immune system to be not activating correctly, or they're taking immunosuppressive drugs and so on. So healthy people. Imagine that this person is not vaccinated and not infected. And imagine this person is vaccinated. Now what will happen is when the virus arrives in this person and the virus starts shedding, and let's say Delta starts shedding faster because it increases in number faster, the viral load is more, it is more contagious, then this not vaccinated person will start shedding, let's say within 2 days, and will continue to shed for many days till their immune system becomes ready. And what is the readiness time? Everybody has a different time, but mostly 5 days onwards is when immune system starts becoming active in a person who is becoming exposed to something for the first time. Again, mechanism, everybody is different. How is it going to be for a specific person? I can't even begin to think about that. This is more of an immune system's behavior from an educational point of view. So now let's say B cells are here and they became activated here, and now they're making antibodies. So we're still talking about this person. Once they start making antibodies, again, a regular normal behavior will be that the virus load that had increased would now start reducing because those antibodies and the immune system responses are going to start, controlling the virus. So the takeaway here is the number of days that the person may shed. So let's say they're starting in 2 days and they continue to shed 5 days or 7 days or something like that till their body takes care of the virus. In some cases, there are studies that said the shedding continued or not shedding, the virus was present or PCR was positive for many weeks. That means they may be shedding for that much time. Now, if we look at the vaccinated person, when the vaccinated person will get the virus's exposure, they would also behave the same way. The virus is going to start getting into their mouth. And if, again, it really depends when did they get the vaccination, what is the state of their immune system at this time when they get exposed. They got fully vaccinated, let's say, 2 weeks ago, and now their immune system is fully active and the B cells are making antibodies and they're already ready. So the virus comes in, it may be that the virus don't stand a lot of chance because the IgA is coating the mucous membrane. It is being actively produced. IgG is present in the blood and tissues. So less chance for a virus, maybe not even a lot of shedding. On the other hand, let's say this person's immune system had gone to rest after becoming activated and trained by the vaccine. Now, when the virus comes in when the person is exposed, let's say it takes 2 days. Once again, same answer, that this could be 2 days, it could be 1 day, it could be 10 hours. I have heard of my friend saying, hey, this is actually a case where they said my wife got the virus. I had the vaccine and I just felt, feverish and tired when I slept. And when I woke up, I was fine. It could be 10, 12 hours. It could be 24 to 48 hours. But during this time, when the person might actually become symptomatic, they are shedding. Now, would they continue to shed for many, many days? That, once again, in a normally vaccinated and activating system of the immune system present correctly, their immune system would become active within 24, 48 hours. And then the virus load would start going down. So their shedding would reduce. What is the point of making this discussion? The point is, it is possible that somebody who is not yet vaccinated will shed for a longer period of time compared to someone who is vaccinated. But they both can shed. And they both can shed variants as well. Depends what is the virus's mutations in that person. Okay, so thank you very much. How about we stop for today and we'll continue. I'm now trying to get back into it. I'll tell you honestly, for a few days, I just could not bring myself to the point to say, let's have a chat, let's discuss. But anyways, all the exceptional things in the pandemic, and one of those is that I usually shut down in times of stress. I am trying not to shut down and just continue. So thank you very much for today. Thank you for being here. Tomorrow, please remember, 9:30 a.m. We'll talk with Dr. Demello, and we'll go from there. If possible, if you're okay, I'll take Friday off, so then I'll join it with Monday's, Labor Day off as well, and I'll have 4 days off. So thank you very much. Love you and all. Stay safe and protected. If you would like to support this work, there are some links in the description. You can buy me a coffee, you can be a patron, or you can use PayPal as well. I'll keep you up to date as much as I can. I don't want to come in here and just make you sad that here is something new happened. But just be aware that there are such things. So thank you very much. See you tomorrow, 9:30 Pacific time.